topics and opinions expressed in the following show are solely those of the host and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert Show on W4CY Radio and Talk4 TV, where we bring you educational information from experts on such topics as legal, health, financial, and home improvement. Now sit back and listen to our experts in community association law, estate planning law, tax relief, Medicare, public insurance adjusters, neuropathy treatment, business brokers, and personal injury law, along with many other topics. Now here's your host for the last 17 years, Steve O.
Morning, Tennessee. Welcome to another Ask the Expert show, where I got to tell you, today's show is becoming one of our most important shows. We're going to be talking ophthalmology, eye surgery. We talk about cataracts. We talk about dry eye, LASIK, smile. I got to tell you, first of all, let me introduce you to our great expert, our superstar, Dr. G with Wang Vision Institute. Good morning, Dr. G. Do we have Dr. G there?
Hello?
There he is. Okay, there you go.
Hey, sorry,
Good morning,
guys.
Dr.
I can't hear you guys here.
Can you hear us? Uh-oh. How about now, Dr. G? Can you hear us?
You guys, but I can't hear you. I'm not sure if you can hear me.
Dr. G, can you hear me? Dr. G, can you hear me?
Uh-oh.
I can hear both of you. Dr. G might need to back out and come back in.
Okay. See, this is what happens when you have a live show. You have technical issues, and hope we're going to be getting Dr. G back on again. It's weird because he heard us there for a while, right, Rebel?
Yeah, I believe he did.
Right.
Yeah.
Okay.
There he goes.
How about now, Dr. G?
Okay. Yes. Now it's working. I don't know.
Okay.
Okay.
Well, Dr. G, I got to tell you what you and Dr. Jones have done for this show. I got to tell you, you are a superstar. And I'm going to tell you, you're busy all day doing surgery and you know, you don't see the kind of emails we get. I'll bet you we've gotten at least 50 emails from the Tennessee area from people who watch your show who procrastinated when it came to cataracts.
Oh, wow.
And you all came on and said that major reason for blindness is not treating cataracts.
100%. 100%.
And it touched so many people, Dr. G, that it's mind-boggling. In fact, I'm one of those people. I procrastinated. And when I heard you say that, I went, oh, I got to get in there. It's such an easy procedure, right?
That's right. 100%. And it's one of those things that's life-changing.
Yes.
So, I tell patients after cataract surgery, now they're back in reality. They're actually seeing colors, enhancements, contrast, everything the way it should be being seen.
And Dr. G, I got to say, I had LASIK 15 years ago. And I know my doctor in Texas told me at the time it's going to last about 10 years. It's been 15 years for me, and I still have not had to use reading glasses. Wow. I think LASIK is the most amazing procedure, but I think Smile has got that beat, right?
Yeah, that's right. That's right. So Smile is small incision LASIK. Here at our practice, we do 8 different surgeries to really help patients out of glasses. So, the eye is 1 inch long, but even within the eye, there's 12 different things you can subspecialize in. So I trained at Hopkins, Duke, then I did a subspecialty in Chicago called refractive surgery. So I do 8 different surgeries all in the front part of the eye to help patients get rid of glasses. So LASIK and Smile are both ways to reshape that cornea so that you don't need glasses. With Smile, there is no big if there is with LASIK. It's a much smaller incision, so you get a lot less dry eye, leading to kind of faster recovery and no flap issues.
Dr. G, the reason why I brought this up is why do people procrastinate with the eye? I mean, I was blown away how many people that we
Yeah.
heard from. Why is that?
I think there's a consequence of 2 things. One, especially kind of in the cataract demographic, when we're getting a little bit older, kind of in our older age, it's not just the eyes that are also kind of giving out. Slowly, the joints are kind of giving out. Everything is just starting to become a little bit weaker. So one, a lot of people don't attribute kind of decline in quality of vision just because they've got other stuff going on. So I think two, people are just they're kind of think, oh, okay, there's nothing to really do about it. Hey, the other thing is, there's a misconception out there, and I think you've hit this before too. A lot of patients, they're told their cataracts aren't ripe enough, but that's not the right terminology. That's not the right way to think about it. I could see 1,000 cataracts that look the same to me, but really, what really matters is how symptomatic you are. So if you're suffering from nighttime glare, suffering from nighttime halos, having difficulty, the vision just isn't as sharp as it used to be, really, you're just delaying, enhanced vision. You could be solving this issue and having better vision, better functionality a lot sooner. The number one thing I hear a lot of times after cataract surgery is patients tell me, Doc, I wish I did this sooner. Doc, I wish I did this sooner. Only if I
Right.
had known. Because really, I mean, they're gaining a whole level of functionality back, and that's when patients realize it wasn't their joints, it wasn't their body. It was just when your vision is poor, almost everything else kind of gives. So poor vision is actually a number one cause for falls in the elderly. So people that if you're having falls, people may think it's neurological or joint related, but it could just be that you've got bad cataracts, reducing your depth perception, leading to falls and imbalance.
Something else I wanted to share with you is, our show, we have many, many states around the country that we offer Ask the Expert show. And when I'm talking to ophthalmologists around the country, their first question is, who else is doing this? And I tell them Wang Vision Institute. Wow, every ophthalmologist that I've spoken to, oh, you've got Wang Vision? Oh, they're
Yeah,
like one of the top people in the country.
that's right. That's right.
What
Yeah,
a,
thank you. Thank you. We appreciate that.
what a compliment. I mean, coming from, your peers in other parts of the country. But so Wang does so many different types of eye surgery. Tell people the different areas that Wang treats.
Yeah, so Wang Vision, we've been in practice for about 20 years, maybe a little bit even over now. And we're kind of a premier practice across the US. We kind of lead in what's called cataract and refractive surgery, more premium cataract and refractive surgery. So again, 8 different types of surgery to help patients out of glasses. So just really depends on your age, your goals, your prescription. So for the younger patients, we do LASIK, SMILE, implantable contact lenses. And then kind of for the elderly patients, we do clear lens exchanges. We also do cataract surgery, and we also do a little bit with minimally invasive glaucoma surgeries. We treat problems called keratoconus. So we kind of do a lot at our practice.
Yeah, you just brought up implantable contact lenses. Um,
Yeah.
that's kind of an alternative to LASIK, right?
That's right. That's right. So, implantable contact lenses, as the name suggests, we implant a contact inside of the eye. So, this is a great way to correct your vision as well, and is an alternative to LASIK and SMILE. So, in the implantable contact lens, we insert a small column or lens right in front of your natural lens of the eye, right kind of behind the colored part of the eye. So it's called the sulcus area. And, it's completely, it's nothing that you'd have to take out, nothing that you can see once you kind of put it in there. The recovery is just as quick as a LASIK or a SMILE.
How does it differ from LASIK and SMILE? Did we lose? Oh no, we lost Dr. G again. Dr. G, can you hear it? There he is. Okay.
Yeah, I'm sorry about my connection here today.
Not a problem. So what is the difference, I'd say, from LASIK and SMILE?
The difference between LASIK and SMILE, so both of those are what are called corneal laser vision correction procedures. So both of them reshape the eye, but the technology that we use is different. So both have great visual outcomes. With LASIK, it's two lasers. So if we kind of think about the cornea from a top-down approach, the LASIK with the first laser, we used to create a flap, lift the flap over, reshape the cornea with the second laser, put the whole flap back down. With SMILE, it's just one laser. So with that one laser, we're kind of able to create a pocket of tissue that the laser delineates. I just go in through a very small incision, so a much smaller incision than LASIK. That's why it's called small incision LASIK. So we go in through that incision, remove that piece of tissue, and the cornea reshapes itself kind of like a reverse contact lens. So compared to LASIK, SMILE has no flap, so you never have to worry about that getting dislodged, and you get a lot less dry eye because the incision size is smaller.
So getting back to the implantable contact lenses, who's a good ideal candidate for that?
Yeah, good question. So the implantable contact lenses, so if people that have very thin corneas, so if you have very thin corneas, you may not have enough prescription, you may not have enough tissue for us to reshape that cornea. So if you don't have enough tissue and that cornea is really thin, then we can implant that contact inside the eye, and then you bypass the cornea completely. Similarly, people with other corneal conditions like severe dry eye, or patients with a history of corneal infections, or patients with a history of corneal conditions called keratoconus. Anything where the cornea has already suffered a little bit of damage, you bypass the cornea completely. By implanting that contact right there, you get great optical quality without compromising the cornea. Another big area is for patients with very high prescriptions. So these are patients that are above a -9, -10. These are all patients where when the prescription is so high, even if you have enough corneal tissue, the quality won't be as great with the LASIK. So even though you're able to perform the LASIK, it's not going to be great because you have to reshape so much tissue. Versus if you bypass the cornea completely and implant that new contact in, your whole cornea is still preserved and you get great optical quality.
We just got a question from TikTok. So if you have cataract surgery and you wear reading glasses, will you be able to get rid of your reading glasses?
Yeah, that's a good question. Yeah, this is 100% one of the things that we really specialize in. This is what we consider what's called premium cataract surgery. So what a cataract is just like a camera has a lens or eyeballs have a lens inside the eye. Over time, that lens does two things. One, it gets very stiff, happens in our 40s and 50s. That's when we lose that ability to read. Two, over time, that same lens, not only does it become stiff, it starts to become gray, opaque, cloudy. That's when we call it a cataract. It causes all that scattering of light. So in premium cataract surgery, what we do is go in there, remove that cataract, and put a brand new lens. It's called an enhanced lens. But there's different technologies out there, such as trifocal lenses, enhanced depth of field lenses. So these technologies allow for patients to get the up close vision, the distance vision, get rid of the astigmatism. So, yes, when we're there, we replace it with an enhanced lens to treat all of it so that you don't need glasses.
Here's a YouTube question from Tennessee. I really love this show. I have learned so much from both of your doctors. My question is, why are some states, when it comes to cataracts, only allow you to do one eye at a time, and other states you can do both eyes?
Yeah, so some states like California do allow you to do both eyes at the same time. Here in Tennessee, they don't allow us to do that. Most of it is from an insurance standpoint. They dictate what's allowed, what's not allowed. There's pros and cons to both approaches. You know, doing cataract surgery on both eyes at the same time, you can allow the eyes to kind of heal together, so there's less downtime. But on the flip side of it, you know, I like doing one eye at a time when it comes to cataract surgery, is so that you're not blurring both eyes simultaneously. You know, we typically do the worst eye first, so you still have your other eye to kind of function while the other eye recovers, versus if I did both eyes, you would be kind of simultaneously blurry in both eyes. You know, but here we do also do bilateral surgery, especially in our patients what we call the lens exchange category, or refractive lens exchange. So it's essentially early cataract surgery. So for their patients in their 40s and 50s that don't like to wear the readers, we just go in there, do early cataract surgery, and put in that multifocal implant. In that case, we're not going through insurance, so we do both eyes on the same day.
On the implantable cataract lens, is that permanent or is it removable?
Yeah, the nice thing about the implantable contact lens is it's reversible. So it sits in front of the natural lens of the eye. And so, say you had issues with it, say it was causing a little bit of glare that you didn't like, or say that it was not exactly what you thought it would be, we can just easily go in there and remove it. Similarly, it doesn't ever have to be removed if it's working for you. So, if it's working for you, causing no issues, the only time we remove it is when it's time for cataract surgery. So as you get older, patients develop cataract. So when you develop a cataract, when we go in there, we remove the implantable contact lens, remove the cataract, put a new lens in there, and that's it. So it's a very straightforward procedure.
This is another question from TikTok. Uh, what type of surgeries do you see with children when it comes to the eye?
Good question. You know, it depends on what, you know, how young the children are. You know, at our practice, we don't operate on children. You know, we refer them to a pediatric ophthalmologist.
Wow.
We do. Yeah. So that's one of the 12 subspecialties that I was talking about within the eye. So pediatric ophthalmologists, they'll deal with pediatric cataracts, also known as congenital cataracts. They'll deal with lazy eye or strabismus. They'll deal with congenital glaucoma, congenital ptosis, which is kind of like an eyelid droop. So it's a whole different kind of field. At our practice, we do deal with kind of teenagers, what's called myopia. So patients that are nearsighted, but their nearsighted keeps progressing at a very fast rate. We have a program called myopia management. So where we talk to them about things that we can do so that your nearsightedness doesn't get worse.
This is from a concerned parent. It seems like my children are always on their cell phones. I know that the letters are much smaller. Do you find that the cell phones and the amount of hours that kids are using their cell phone is doing any damage to their eyes at all?
Yeah, very good question. So myopia or nearsightedness is kind of how fast and how long the eye grows, causing us to have a prescription. So like when patients have a -5, -6, that's called nearsightedness or myopia. So they have shown in children that the two things that we can do to help reduce the risk of myopia or the risk of you getting more and more nearsighted is increased kind of sunlight exposure, so playing outside, being outside more, and two, decreased near time. So kind of, yes, spending less time on those tablets, spending less time on the phone. All of those things, they cause you to accommodate more, and then the eye starts to become more nearsighted. So yeah, I mean, if you're a kid and you're young, you definitely want to make sure you're not spending as much near work and kind of spending more times outside.
Dr. G, I don't mean to lay something so heavy on you in the morning, but I got to tell you, you and Dr. Jones have touched so many lives on this show. And it's so good to be part of this incredible show with Wang Institute. Tell people how they can reach if they want to set up an appointment, Wang.
Yeah, 100%. Yeah, thank you. Wang Vision Institute, we're in Nashville. You can call us at 615-321-8881, or you can go to our website at www.wangvisioninstitute.com. We have a section there where you can directly reach us, directly contact us, make any kind of inquiry you have. We'll always get back to you. So any of those methods always all work.
And Wang Institute is with us every month. Dr. G, I can't thank you enough. Have a wonderful month, and we'll see you again next month.
Yes, thank you guys so much for having me, as always.
Okay, Dr. G. That's the Wang Institute. That's going to do it for us today. We'll be back again with you next week with more Ask the Experts.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.